Hello, everybody. This is Dr. Khilnani, Chairman, PSRI Institute of Pulmonary Critical Care and Sleep Medicine, and formerly head of the Department of Pulmonary Medicine at the All India Institute of Medical Sciences. I'm going to talk to you about air pollution and health, a man-made emergency. Like every year during Diwali time, we go into some kind of trouble. And this is the newspaper picture of Times of India on the post Diwali day, saying Delhi was worst Diwali year in 4 years, where majority of stations could not record the PM 2.5 because it went beyond their measuring levels, and some of the actually stations like at Lajpat Nagar, the PM 2.5 was 1763, where the Indian standards are 60 micron, whereas the WHO standard is 15 micron. Why we are in this mess? Why we are in this medical emergency? That is, I am going to talk to you in next 20-25 minutes. And this is how we celebrate our Diwali. This is what happens to our atmosphere. This is what happens to our visibility in the morning of the next Diwali. And what is the impact on AQI? And more importantly, what is the impact on our health? And this is nothing new. These are cuttings from the old newspaper. Daily pollution deaths up by 100% since 1991. This has become a routine for people living in Delhi NCR. And it's not unusual to see this kind of news that Delhi is world's most polluted city. So what is the implication and why we are in this man-made mess which can be called as a tragedy? And what can be done? And that is what I'm going to talk to you. Now, why the health is affected by air pollution? Because the air enters through the lung and we inhale 10,000 liters of air every day, and we require 420 liters of oxygen for survival. And the World Health Organization reports that in 2012, around 7 million people died as a result of air pollution exposure. And now air pollution is now the world's largest single environmental health risk. Now, India Gate, which we all are proud about, it's a sightseeing place for people who come from outside. This is the India Gate that you see during Diwali. And what happens post Diwali? You can hardly see India Gate during daytime because of the smog around. What we deserve is this India Gate. This picture is taken during lockdown period when the city was locked down. We were living in a natural environment. The roads were empty. The traffic was not there. And this you could see the clear, beautiful sky with perfect visibility. This is a picture of provided by my colleague, Dr. Arvind Kumar, who is a surgeon. And this is the lung, which is daily lung, which is a charred lung, and no amount of antibiotics or bronchodilators can make it a pink lung of a person who is from outside Delhi. Now look at what is happening. India got independent in 1947. By 1951, our life expectancy at birth was 35 years. By 1991, our life expectancy was 58 years. And by 2023, we crossed 70 years, and actually now it is about 72 years. Now, but if you compare the life expectancy with, say, Australia, Switzerland, New Zealand, which have a life expectancy at birth as 83 years, we are still lingering at 70. Why? There is a difference. So the Chicago study, which came in year 2023, which estimated scientifically that lifespan of Indians is reduced by an average 5.3 years due to air pollution, and lifespan of Delhiites is reduced by staggering 11.9 years. And there was improvement in lifespan of Chinese by 2.2 years following strict measures to control air pollution, meaning thereby, if we control the air pollution, our life expectancy would improve. That means that it's not only the longevity of life, the quality of life and overall health status would also improve. How pollution was noticed? It's not something very old. It is actually relatively new. The Great London Smog, which we all talk about in December 1952, when the air pollution episode incident occurred. Analyzing the data, it was realized that there were 12,000 excess deaths during those 3 months. And when they looked at the causes, it was found out that this was mainly because of the smog caused by air pollution, and this was because of the use of coal. At that time, London was undergoing industrialization, and coal was used by various factories and for electricity generation. Similarly, the World Trade Center tragedy in 2001, when they investigated patients around that World Trade Center, the what is called as ground zero, 60 to 70,000 responders were exposed, and it was seen that they had respiratory infection, both upper and lower, asthma, reactive airway disease, interstitial lung disease, eosinophilic pneumonia, granulomatous pneumonitis, and bronchiolitis. So, where does the pollution come from? That is, it is important to know the origin of the pollution so as to control measures can be taken. So there are the sources are stationary sources out of which public power production, that is majority of the electricity what we are consuming is generated by coal. There are industrial combustion, there are production processes, there are biomass consumption, there is fossil fuel combustion both at home and outside, and waste treatment disposal. The daily waste burning causes 4% of air pollution in the city. Road transport are the one of the biggest culprits, and it's not unusual to see this kind of traffic snarls, especially during festival season and during the rainy season. Of course, the industries like brick plants and stubble burning, which we see every year, and now also we are seeing, and the indoor air pollution also contributes. And the result is that this kind of smog, which is not an unusual sight that we see, and this kind of garbage heaps are there, which we keep burning, adding to our health hazard. Now, how does they cause adverse effects? We keep hearing PM 2.5, we keep hearing AQI, and we say, oh, the AQI is now severe, now the graph will come, that construction would start, the BS4 cars will not be allowed to fly, and so on and so forth. So what are these AQIs made up of? There are six main air pollutants, out of which particulate matter is important, which is determined by the aerodynamic diameter. Among the gases, nitrogen dioxide, sulfur dioxide, and carbon monoxide, and ground level ozone, which is formed by the interaction of nitric oxide and volatile organic compounds. Lead is largely been kept away by making the petrol lead free. So these are the five air pollutants which are important. And how does it affect our lung? We keep hearing PM 2.5, yeah. We keep hearing PM 10, and then what I like you to know about is ultrafine particulate matter. The particles which are more than 10 microns do not enter the lungs, and they are stopped because of the nasal filters. The particles which are less than 10 micron and more than 2.5 micron, what is called as PM10, they are deposited below the larynx, that is our voice box. And the particles which are what is called as PM2.5, that is between zero point 0.1 and 2.5 micron. These are the most harmful, and they get deposited in the lower airways and cause all the diseases, including bronchitis, exacerbation of asthma, and lung cancer. What we generally don't talk about is ultrafine particulate matter, which is called nanoparticles. These are very, very harmful particles because they not only go to the lowest part of the lung, they also penetrate the lung and go into the blood circulation. And they go to all parts of the body, including brain, heart, intestines, and urinary system and genital system, and cause heart attacks, brain attacks, cancers, and so on and so forth. So, talking about individual heart effects of air pollutants, sulfur dioxide is causes cough, bronchoconstriction, asthma, and bronchitis. The major source is from the coal burning. Nitrogen oxides, they are emitted by stove, kerosene, and from the vehicles. They also lead to formation of ozone, and they cause asthma. Carbon monoxide actually penetrates the lung and binds with the hemoglobin and cause uh, damage to the, especially to the heart, and it the acute exposure actually can kill a person. And because of the carboxyhemoglobin, the oxygen deficiency is there, which which leads to anemia and chronic heart lung disease, and it particularly affects people who are smoking. The ozone, of course, is formed by the interaction of oxides of nitrogen with volatile organic compounds, and is the causative in asthma and COPD. We all hear about AQI, air quality index. So, what is AQI? Let's understand what is AQI. In 2014, the Government of India Ministry of Environment and Forest thought that there should be one expression for depicting air pollution. So there should be one index. So a committee was formed, and that committee had two doctors also, me and Dr. A.K. Agarwal. It was led by Dr. Mukesh Sharma from IIT Kanpur. And the AQI was formed and expressed as one index. As you know, that AQI 0 to 50 is considered sort of okay, then 50 to 100 and 100 to 200 and 400 to 500 is very poor, and then more than 500 is hazardous. What are the health risks? Right from the birth, even before the child is born, there can be birth defects, there's chronic and acute bronchitis, there's respiratory illness, there's heart attack, and variety of cancers, not only of the lung, but all the organs, including intestines, the food pipe, the urinary system. All cancers can be caused by, and the nervous system damage, including strokes and dementia. The high risk groups are infants, children, pregnant women, elderly, and those who have pre existing cardiorespiratory diseases like asthma, bronchitis, or other diseases like interstitial lung diseases. And not only that, people who have pre existing diseases are affected, but the healthy people have discomfort such as irritation to the nose, throat, eyes, and skin. There is a headache, there is dizziness, there is nausea. Also, there are sleep disturbances. One feels tired, one feels lack of energy. Even the appetite goes down. And this is what we are experiencing these days all the time. In the respiratory diseases, there is exacerbation of asthma, COPD, chronic obstructive pulmonary disease, LRTI, and lung cancer. And it causes ischemic heart disease, heart attacks, and cerebrovascular accidents. Uh, what is the impact? When I was starting my career in pulmonary medicine, the nebulization machine was a rarity. Rarity. And nowadays, if you ask somebody if he has children in his house or the elderly people in the house, they usually have a nebulization machine at home. Taking inhalers has become so common in city of Delhi NCR that every other person is using inhalers at some point of time or the other. Similarly, the oxygen concentrators are, especially after COVID, are present in many of the households. The cancers, one of the biggest killer, are also caused by air pollution, and it is proven that diesel and kerosene emission leads to lung cancer, which is number one cause of cancer deaths all over the world. As I said, fine particulate matter will impact the blood vessels. It causes calcification in the artery. It also causes brain damage and can cause brain hemorrhage. As I said, the all types of cancers, including the blood cancers, can be caused by as part of adverse effects of. The children are particularly affected. In Delhi, every third child is now suffering from asthma. Their lung growth is affected. The daily lung capacity is much less than the children of other parts of the country. The pregnancy, there is increased incidence of preterm birth, there is increased incidence of low birth weight, and it also led to maternal and fetal deaths. So, summarizing the impact of air pollution, uh, there are there are large number of people who have subclinical effects. They feel tired, they get little bit of sore throat, they and they don't sleep well, the appetite goes down, there is a running nose in response to air pollution. There are smaller proportion which have symptoms and decline in lung function and increase in medication use, like those who are using inhalers. There are proportion of people who have hospital visits. There are proportion of people who have emergency and hospital admission, and there is death. So as I told you that life expectancy of Indians has gone down by 5.3 years only due to the air pollution. Now, what is the evidence from India? And this was a study conducted by my mentor, Dr. J.N. Pandey, I was part of this study where in 1997, 98, we we found out that there was an increased incidence of asthma, COPD, and heart attacks in response to air pollution by 21, 24, and 24% respectively. Based on this, the Honorable Court came with the order that CNG should be introduced and all the small scale industries must be relocated 50 kilometers away from Delhi. Now, this study, which is a time series study, has shown that in the NDMC area, there was 0.11% increase daily mortality with each 10 microgram of increase in PM10. That time 2.5 data was not available. So based on this, international journal, Current Opinion Pulmonary Medicine, invited me to contribute an article on air pollution in India and related adverse respiratory health effects, past, present, and future. And in this article, another editorial said that air pollution in India is the lead article in this issue of COPM. The Khilnani and Tiwari take an unblinking view of these causes of air pollution in India. What we wrote in this article that there are 6,000 premature deaths per day and household air pollution attributable mortality is 17% as far as the lung cancer is concerned and 33% as far as the COPD is concerned. So, the summary was that there is increased premature deaths, there is a respiratory cause of increased respiratory cause mortality, there is increased exacerbation of COPD and increased health expenditure. So finally, what can we do to reduce ambient air pollution? So this was a study conducted by two eminent scientists, Dr. Mukesh Sharma and Dr. Omkar Dikshit, both professors at civil engineering in IIT Kanpur. So this study was conducted in Delhi, and there was it, they discerned that vehicles contributed significantly to the air pollution. The implementation of the BS6 for all diesel vehicles, including heavy duty vehicles, BS6 engine use fuel that contain less sulfur and less harmful. BS4 engine use fuel with real sulfur produce more harmful emission. So therefore, they recommended that electric or hybrid vehicles should be used and the charging facilities have to be improved. And this will improve the air quality of 50 points. They also said that people should use public transport rather than individual vehicles, and this will also improve. Now, construction site air pollution is significant, which is not recognized. And if you the the methods of constructions are followed, like covering the construction sites and water sprinkler and all, that will also help. There is a significant pollution by tandoors, which are about 9,000 in Delhi, and that also will, if you stop using coal, that will improvement by 80.56 points. Domestic cooking by LPG, that has been largely been taken care of by LPG. This will also improve the air quality by 50 points. Now, construction and demolition needs to be improved by vertically cover the construction area, handling and storage of raw material, water spray, and store the waste inside the premises with proper cover. And that would also improve the air quality by 50 points. As I said, 4% of the air pollution in Delhi is caused by municipal solid waste burning. If you prevent that and find an alternative way, this will the percent improvement will be 100 points. Road and soil dust, they recommended that vacuum sweeping of major roads should be done 4 times a month, carpeting of shoulders and mechanical sweeping, and plant small shrubs and perennial forges, grass covers in the open areas. That will improve by 70 points. And as I said, that coal electrical generating plants within the 300 kilometers of Delhi, they also add to the air pollution. So doing desulfurization and doing denoxing, that is you there are machines have to be changed so that sulfur dioxide and nitric oxide is not generated. Uh, this will improve the air quality by 90 points. Biomass burning, of course, this is very important, and every year we see the parali burning. This will improve the air quality by 90 points. At personal level, uh, one should protect. There are but uh, one should reduce the times spent outside as far as possible. Not everybody can do that. And if you want to go outside at the time of severe air pollution, consider wearing a mask. N95 or KN99 mask should be used. Cloth mask and surgical mask has no value for protecting from air pollution. One should never go for running or jogging or exercising in the early morning when there is a smoke. Now, your indoor air quality is also important. So, air purifiers everybody is using in city of Delhi, thinking that this will clean the air. Partly it is true, but how to use air purifier? You have to leave air purifier on all the time. Place the air purifier in the room where you spend most time. Leave your air purifier in the same room. Keep the door and windows closed when your air purifier is on. Point the flow of clean air towards your breathing zone for maximum results. Avoid ionic air cleaners and ozone generators and replace filters on time for maximum efficiency. The room has to be closed all the time, and the capacity of air purifiers should be commensurate with the volume of the room. Of course, these air purifiers have a potential to generate ozone, which itself can cause asthma. Finally, this is the graph. During May, June, July, August, the AQI is low. October, November, December, the AQI is high. So Bhakt Kabir, his famous doha said that दुख में सुमरन सब करे सुख में करे न कोय जो सुख में सुमरन करे तो दुख का है कोय, which is so true when you talk about air pollution. This is the period where there is a sukh. We don't worry about it. We wake up only during Diwali time. So we have to act all through the year to prevent this surge of air pollution during Diwali period. So conclusion is that air pollution constitutes a health emergency of alarming proportions. Air pollution is associated with increased all cause as well as respiratory morbidity and mortality. Urgent measures at all levels are needed to avert this crisis. Now, our father of the nation said the difference between what we do and what are capable of doing would suffice to solve most of the world's problem, and that is so true as far as air pollution is concerned. Air pollution is our man-made generated problem. It is our problem and it affects us. If we all act in our own capacity to reduce the air pollution, we'll be able to solve it. Thank you very much for your kind attention.